Facelift and neck lift scars, the good, the bad, and the ugly. So, facelift scars and neck lift scars, everything you need to know. A really common question about face and neck lift scars that patients ask me is, where will they be? What do they look like? How do they heal? Will my hair be shaved? So today we're just going to talk about everything there is to know about where these facelift scars are. And so why is this important? Well, because there's loose skin that needs to be removed with facelift surgery. When that loose skin is removed, well, we need to make a scar somewhere. So if that scar's in front of the ear, well, it has the potential to be seen. So really, well, we want to keep scars in natural lines, natural creases around the curves of the ear, because in certain areas of the face, they potentially can be more visible. And if you have quite a lot of loose skin, they can change where the hairline is. So this is an example of a patient who came to see me. The hairline has been moved, the scar is more visible, so it looks a little unnatural. So I completed revision face and neck lift surgery for this patient to lower the hairline to create a more natural appearance. So why is it important? Well, there's so many different types of scars, there's so many different positions and shapes, and we really want to avoid bad scars, and we really want scars to be hidden, discreet, difficult to see. So what I'm going to do is going to talk you through each and every type of scar, why some facelift and neck lift scars are used, what are the advantages, what are the disadvantages, so you're fully informed. And of course, there are shortcuts, and if shortcuts are taken, a scar can take 10 minutes to do. If precision, detail, the scar is made refined in natural curves, it's shaped in a way that it's within the hairline and beveled so hairs go through that scar, well, just closing the scars can take even 60 minutes, 6 times as long. So we're going to talk through what this means. So a mini facelift, well, what does this mean? Well, it means that there's only mild facial aging, and by that it means there's little loose skin, mild skin laxity. So often with these types of scars, they can be hidden within the natural curves of the ear. So this part of the ear is called the tragus, and the scar can be hidden along the very edge of the hair, of this line, and then into the hair. And so the scar is largely hidden, and then depending on how much loose skin there is and what is required, the scar may or may not go just behind the ear. So this is not really suitable for patients who have more loose skin, because if someone has more loose skin, well, if the scar is made in this area, what can happen is when that loose skin is lifted, it can raise the hairline. So it's suitable for some patients, but generally with mild skin laxity. What about endoscopic facelift surgery? Well, endoscopic means a hidden camera is used, a 3D telescopic camera is used. And in this technique, the scar can actually be hidden within your hairline. So the scar is actually virtually invisible. However, there really needs to be no or very, very minimal skin laxity. So these are generally going to be they're going to be younger patients or patients who have just very good skin tone, sometimes ethnic patients. And the scars are hidden within the hair. And we can also use other kind of like non-surgical radio frequency devices to tighten the skin. So if there's a little bit of skin laxity, we can use alternative technology to tighten the skin. And the advantages of this is, well, the scar is completely hidden. The disadvantages, well, only very few people are actually this can be effectively useful. Because if you have a certain amount of loose skin, more than millimeters of loose skin, well, it's just not going to really help for these patients. But it's using 3D telescopic camera. We can hide the hair in the hairline and get to this area and get down to the cheek area, and we can lift this cheek area. And I've made other videos talking about this technique. I do hope this information has been helpful for you. Please don't hesitate if you have any questions or queries, and thank you for watching.